A doctor's first. The never-before-seen liposuction on this body part. All new doctors. Disturbing. Parents are advised that these images may not be suitable for young children.
From cankles to spare tires to double chins, people are self-conscious about excess fat on every part of their body. But this next pudgy part is one that we've never really considered until now.
Yvonne has extra fat on the dorsal part of her wrists, and it's very embarrassing and it's really hard to hide.
I don't like the look of my fat wrists. They make me feel very, very, very self-conscious. No matter how hot it is, I'm in a long sleeve shirt. I'm always tugging out my sleeves. Well, I tried dieting, but that part never went away. It stayed there. For my 15th anniversary at work, they presented me with a watch. I knew it wasn't going to fit, but I tried it on, and it wouldn't close. I was so embarrassed, I was sweating.
We see some other areas in the body that are maybe not as common to see fullness. Yeah, we want to contour this a little so that you don't have this. I can see where it's noticeable when you hold your hand out. So we're doing tumescent liposuction, meaning we put fluid under this layer of fat to lift up this fat from lower structures we're trying to avoid, like your blood vessels, your muscles, your nerves, and that makes it easier for us to remove the fat more safely. Almost ready for the suction. We have a small canister laid out, right? And what I'm doing is essentially doing a cookie cutter, like a little punch on the surface of the skin. So that's where I'm going to put the little cannula. Is it kind of strange to see it all coming out?
I'm just imagining how it's going to look like after.
It's already starting to look better. You see how it's flat here? Looks good. All right, one down and one to go. Done.
Yvonne now joins us. How long ago did Dr. Lee do that procedure?
2 weeks ago.
2 weeks
Just
ago.
2 weeks. And do you have any news for us, Yvonne?
Yes, I have new wrists. I hid behind.
Take a look at that. And obviously, I think you're seeing in the camera, she is swollen. She still has a little discoloration, a little bruising. That's perfectly normal at 2 weeks. Let's even take a closer look. We have some still photos before and after. And you mentioned it, Dr. Travis. Interesting. I mean, she has a very unique deposit of fat on the upper part of her arm that you don't see very often. Now, I've done liposuction on almost every part of the body. I'll be honest, I have never done it on the wrist. But you had a condition where this was a reasonable way to treat this, and I think
You call it lipodystrophy, right?
Lipodystrophy, yes, that your body is actually programmed to accumulate fat in an unusual place. I mean, it can happen anywhere, and in your case, you just had it on your arms there.
Because this is a procedure that you wouldn't recommend for most people, and this is a unique circumstance, right? Because
Exactly.
there are more complications in this area than maybe the other ones you typically will do liposuction.
Well, for sure. This is a very delicate area in the wrist. You know, you have all the nerves and arteries that are going to the hand, sensation, the blood vessels, carpal tunnel, all those things. If you were to get a lot of swelling in this area, you could have what we call a compartment syndrome or compression to the hands. So as long as you're in the hands of somebody who's experienced, knows how to do liposuction, and knows how to recognize complications and treat them, then I think it's a reasonable way to go.
And certainly an opportunity to say a thank you to Dr. Lee, who couldn't be here today. Clearly you are happy, right?
Great job. It was an event that happened. They wanted to give you a watch for a work anniversary, right? And you tried to put it on, and it didn't quite fit. Dr. Travis and I have a little present for you here. We'd like you to open it now, please.
Okay.
Look at that.
Thank you.
Look at that Movado watch.
Thank
And
you.
now with your new wrist, shall we try it?
Okay.
No time like the present. It's a beautiful watch.
It's gorgeous. You
Thank
kidding
you.
me? Look at that.
And certainly a wonderful result. Thank you, Yvonne. Like Dr. Orden said, this isn't going to be the common procedure for most people because there are potential complications, but we were just so happy you had a great result.
Thank you.